Yeah, thank you for coming in today. Um, I know these appointments are not always easy to make it to. Um, Before we jump in, I just wanted to do like a quick check-in. Um, how is school going?
Right now it's going pretty good. It was stressful earlier in the semester, but the content has gotten easier and I've gotten more confident with my knowledge.
Good. That's really great to hear. What exactly have you studied like this last week?
This last week we've been doing psych
Okay.
in our class. We've been learning about mental health issues like schizophrenia, schizoaffective disorder, and bipolar.
Yeah. Okay. I mean, those are all things that I love. You know that. Cool. Very cool. I mean, it does sound like a lot. I know you are currently juggling what? School, clinicals, and then, things at home, right?
Yeah.
Okay. How are clinicals going?
They're going good. Um, for our psych clinicals, we've been mostly observing because as students we can't give medications to patients in psych units,
Okay.
but it's been very educational and a good learning environment.
That's awesome. Sounds like a lot.
Yeah, it is, but
Yeah, psych
I
is
like
tough.
it.
You do?
I do.
Okay. Yeah, psych is tough. Behavioral health in general can be really challenging. It sounds like you're handling things really well, though.
I am.
Good. Okay. What about home? How are things with your mom?
Um, they're good. We have a good, healthy relationship.
Yeah? Okay. And how are things between you and your mom's husband?
Um, they're better now than they were in the past. We don't argue as much. There's no hostile feelings currently.
Okay. That's great. That's really good to hear. Because I know he's been difficult in the past, yeah?
Yeah.
Okay. Okay. Um, well, today I figured we could focus on some of the anxiety that that you had previously touched on. I would like to introduce you to what's called acceptance and commitment therapy, ACT, and some skills, that can help you put some space between like your authentic self and some of these anxiety-inducing thoughts that you've been having instead of like allowing them to cause you to spiral.
Okay.
Yeah, that sounds okay?
Yeah.
Okay. So walk me through what's been like the most stressful part about school lately.
We have finals coming up in the next few weeks, and I've been a little overwhelmed with trying to study everything that we've learned throughout the entire semester, on top of the assignments that we have due.
Okay. Yeah, finals are tough, especially while you are preparing for assignments that are still due, and showing up for your clinicals. What have you been doing to study?
I've been going through the PowerPoints and looking. Um, our textbook has practice questions in it, so I've been doing those to help me study.
Okay. Um, are you hoping to get an A in this class or a B?
I'm hoping for a B.
A B? Okay. Where are you at currently, like percentage wise?
Right now I'm at an 82%.
82? Okay. So yeah, so a B is, that's realistic. Has your mother said anything about it not being an She's okay with a B.
Yes.
Okay, so the expectations at home are realistic.
Yes.
Okay. So you're internally motivated. It's not that your mom and stepfather are placing like unrealistic expectations on you.
No.
Okay. And you have a realistic expectation of yourself, it sounds like.
Yes.
Cool. Super healthy. Um, so when you notice like this stress and this anxiety show up for you, um, is it more of like a physical sensation? Do you feel it somewhere in your body? Or is it more like obsessive thinking, racing thoughts?
I feel it in my chest, and I do have racing thoughts.
Okay. So both.
Yes.
Okay. Um, can you point to where you feel it?
Right.
Up here?
Yeah.
Not down here?
No, it's more up here.
It's in there.
Yeah.
Okay. Cool. Thank you for clarifying. Okay. So the introduction to ACT, the exercise is called cognitive diffusion. Basically, what we're going to do is we're going to learn how to um, observe thoughts from like a third person perspective without judgment. So putting some space between ourselves and our thoughts.
Okay.
Cool. Um, would you be open to trying a quick exercise with me?
Yes, I would love to.
Okay, thank you. When your anxiety shows up, like when you think about school, um, what is a thought that pops up like immediately for you?
I think just not passing the class.
Okay, and that's realistic. Um, that's totally understandable. That carries a lot of weight. So instead of saying I'm going to fail, let's say um, I'm having this thought that I'm going to fail. Does that make sense?
Yes.
So rather than saying I'm going to fail, it's okay, I'm having this thought that I'm going to fail. You see the difference between the two?
Yeah.
Okay, awesome. So let's slow that down like even more. Um, sorry, sounds like the people next door have something going on. I apologize for that.
That's okay.
Okay, so let's try that again. Let's think about school. Okay, what is that first thought?
That I'm going to fail this class.
Okay, so rather than like entertaining that thought of I'm going to fail, it's okay, I'm having this thought that I'm going to fail. Realistically, uh, you're gonna pass and you're gonna do great. Um, but again, like we have these thoughts sometimes, and like the best thing we can do is observe them without judgment and do our best not to entertain the thought or engage with it. Does that make sense?
Yes.
Yeah? Okay. So that's the whole idea. The thought is still there, but now we're observing it, rather than being inside of it. Okay. So let's try something else. I want to ground you for a second, okay? mindfulness exercise, like a grounding exercise, yeah, go ahead and put both feet on the floor. And then put one hand on each knee like you're doing. Perfect. Okay, so go ahead and close your eyes. Okay. I want you to take a deep breath with me. Hold it at the top. Quick inhale. Hold it. And exhale slowly. We're going to do that 2 more times, okay?
Okay.
All right. 1, 2, 3. Hold it. And exhale. And one more time, okay? 1, 2, 3. Hold it. And exhale. Did that help at all?
Yeah. I feel more relaxed now.
Do you?
I do.
I mean, you look more relaxed. Cool. So, when the thoughts come up, and they always do, um, see if you can use the exercise that we just did to kind of let them pass through rather than getting stuck. Does that make sense?
Yeah.
Okay. Alright, so we're going to shift from thoughts to values. The direction in which you want to go and the direction you want your life to go. So what kind of nurse do you want to be?
I want to be a pediatrics nurse.
Pediatrics? Okay. That's amazing. You like working with kids?
I do.
Okay. And in order to be an effective pediatric nurse, give me 3 qualities that come to mind.
Compassion, empathy, and communication.
Okay. Compassion, empathy, and good communication skills.
Yes.
Yeah. Communication skills are important. How else can you relay information to your patients if you can't communicate effectively? Those are great values. And even with anxiety, you're showing up for yourself and you're showing up for your patients.
And the families.
And the families. That's huge. Not everybody can do that. Cool. So, if you were to take one small step this week, that aligns with your values, what would it be?
I would make sure that I'm available for my patients to listen to them and what they're going through.
Okay. So active listening?
Yes.
Okay. So compassionate, empathetic, and that'll allow you to work on your communication skills also.
Yes.
Terrific. I love all of that. So today we looked at what's causing stress, what's causing anxiety, how these thoughts show up, and then we practiced diffusion. We stepped back from those thoughts rather than allowing them to take over, and we connected to your core values as a future pediatric nurse. for next week, can you do one thing for me?
Yes.
Actually, let's do two things.
Okay.
I would like you to work on um, like grounding to help you with your anxiety.
Okay.
So when you feel like that tension, uh, in your midsection, maybe sit like we practiced. Close your eyes. Take a few deep breaths. Uh, with some elongated exhales. And then I also would like for you to choose like a values-driven action. So think about your values: compassion, empathy, and communication. And try to implement something small. Doesn't matter how small. All you need to do is identify something, implement it, and then see it. Excuse me. See to it that you follow through.
Okay.
Yeah. Okay. Um, is that manageable?
Yes.
Yeah. Okay. So you did great today. Um, you were open. You were honest. You leaned into the exercises, which I'm sure they were a little bit weird. Yeah. So that's not always easy to do. You are showing up for yourself, even with the anxiety, which I mean that's big. You know, not everybody can do that. And we set some goals for the upcoming week. Any questions?
No.
Okay. We will continue working on these things when I see you next Friday. Okay.
Okay.
Awesome. You did great. I'll see you then.